Absolutely. So it's a real pleasure having Dr. Anoop here. He's presented at our previous conferences and has been a huge hit simply because of the vast amount of knowledge he has related to emergency medicine, as well as the training route for emergency medicine. So please click any of the options. Have you considered a career in emergency medicine? We don't.
So there we go, Anoop. You've got around 50-50 really. So let's say 60% of people have not thought about a career in emergency medicine, but actually over 40% have. So you've got an audience here that wants to know a little bit about this, but maybe some others who are a little bit unsure. So we're going to hand it over to you. That's a good place to start with.
Good morning, Pooja and Aman. Hope you can hear me and see my screen.
That's great. We'll leave it to you then, Anoop. Thank you.
Thank you, Pooja. Thank you, Aman. Good morning, everyone. It's great to see you all across the globe attending this conference. First of all, kudos to Aman and Pooja for organizing this every year. And I think every year I come to this to speak on this webinar, I think my excitement goes up and up again because of the variety and diversity of audience. Well, I'm Anoop. Pooja said I'm one of the emergency medicine registrars working in the southeast of England. Today, I'm going to talk you through about specialty training of emergency medicine in the United Kingdom. Few quick points about me. I completed my undergrad and post-graduations from India. I completed my MR Chem in 2016. I obtained GMC registration through acceptable postgraduate qualification, which is my MR Chem, and then moved to the UK in 2017. My first job was senior clinical fellow in emergency department in the east of England. And I've spent few months getting accustomed to the NHS and getting to know about the local guidelines and policies. And once I was comfortable with this, I started preparing my portfolio. I was successful both in ST1 and ST3 interviews, and I opted for ST1, and I commenced my training in the south of England in August 2018. I've just recently stepped down from the emergency medicine ACCS rep, which I've been holding it for 2 years. I also have been helping lots of IMGs with their portfolio preparation, specialty interviews, and helping them with the mock interviews. Cool, let's get started. Why emergency medicine? Well, lots of people ask me this question, and I think I will be able to up that yes whole question after my presentation, hopefully. So, emergency medicine, we are generalists. Yes, we know. We have to know about almost all of the complaints and presentations because we have to treat everyone that walk into the emergency department. Lots of procedures being involved in emergency medicine. There is an opportunity for research in emergency medicine. You are able to up your leadership skills because usually the emergency medicine registrar, the consultant will be the trauma team leader or the cardiac arrest team leader, by which you'll be able to up your leadership. Because you interact with a wide variety of specialties and registrars and SHOs and consultants, there's an opportunity for you to up your communication skills. As I mentioned before, broad knowledge about everything. So you will have to know about all specialties so that you're able to treat them at the front door. Work-life balance, although the rota is not as smooth as other specialties, some of them find it very convenient because rather than doing 8 to 5 job from Monday to Friday, some of them feel that because of the wide variety of shifts, they're able to balance their life with their life and work. They're able to manage their childcare because of the rota shift pattern. Management, lots of opportunity for your management skills in the NHS when you work in the emergency department. So the emergency medicine training program in the United Kingdom is 6 years. To become an EM consultant, you need to be on the GMC specialist register as EM consultant. That can be obtained via either training or non-training. Your non-training is about a CSER, where you submit all your evidences to your CSER panel, which then they forward it to the GMC, and then you are registered on the specialist registers as an EM consultant. Training, there are 2 different pathways, which we will be talking in detail subsequently. One is through the ACCS, which is you start from ST1 and go up to ST6, at the end of which you will get CCT, which is your certificate of completion of training. The other option is you can enter at ST3 level or ST4 level. If you enter through ST3 level, the dream pathway, which is your defined route of entry into emergency medicine, and if you have completed 5 years of your training program, a minimum of 5 years, then you are eligible to get a CCT, which is your certificate of completion of training. But if you are less than 5 years of training, then you will get a CSER CP when you register the GMC. This is as of now. It might change in the future. Please refer to the GMC and the ACCS website for further updates. As I mentioned earlier, the emergency medicine training program is a 6-year training program. You can get it as a coupled one, which is you start from ST1 and finish at ST6. However, there is an option for an uncoupled training also. What do you mean by uncoupled training is you start applying for ST1, you finish ST1, ST2, and ST3, and then you reapply for your ST4. You again attend the interviews, and then once you're successful, you again enter into ST4. There are pros and cons for each of those. Where when you are an IMG, most of them prefer coupled training because of the visa issues, because it's straight run through program from ST1 to ST6, so there's no issues with your visa and your COS. So this is the one that I was mentioning earlier. EM training is when you start from ACCS, you start from ST1. Your dream is if you have got your core competencies signed off elsewhere, or if you have got the evidence that you've achieved your core competencies, then you can enter through ST3 via the dream pathway, which is you'll be doing 2 years of ST3 and then ST4, ST5, ST6. If you have done 5 years of EM training through dream program, then you are eligible for CCT. The other option is straight getting into ST4 straight away, provided you have all your core competencies and your intermediate training competencies, which is your ST3, and then you again apply via the emergency medicine recruitment platform, and then once you're successful to interview, you will get your training number at ST4, which you can start, and then you'll be doing 3 years ST4, ST5, and ST6, at the end of which you will be completing your training and registering with the GMC as EM consultant. EM, again, ACCS is ST1, 2, and 3, which is ACCS is your acute common care specialties, which is common to ED, anesthesia, acute medicine, and sometimes intensive care. Your ST3 is your intermediate training in emergency medicine. Your higher specialty training, which is your HST, is ST4, ST5, and ST6, where you will start developing your skills to become an ED consultant as an independent consultant. So your ST1 and ST2 is at these 24 months, you'll be doing 6 months each of emergency medicine, acute medicine, intensive care, and anesthesia. In some hospitals, you might get an opportunity to work in general ICU and neuro ICU in the 6 months of the intensive care. And in some hospitals for acute medicine, either you might have 6 months of acute medicine, or you might have 3 months of acute medicine and 3 months of general medicine or respiratory medicine or cardiology, depending upon your local policies. However, your anesthesia will be 6 months and your emergency medicine will be 6 months. That's your ACCS or acute common care specialty year, which is 24 months, 6 of each of these 4. ST3, you will be based in ED, where you will be getting more exposure to musculoskeletal and minor injuries, and also you'll be exposed to the pediatric emergency medicine. ST4 to 6, you will be based in the emergency medicine department, which is your higher specialty training, and you will be developing your leadership and management skills so that you can practice as an independent EM consultant. Coming to the exams, the Royal College of Emergency Medicine controls the regulatory body for emergency medicine in the United Kingdom. You have an MRChem, which is your master member of Royal College of Emergency Medicine, and then fellow of Royal College of Emergency Medicine. So MRChem, you have the primary, intermediate, which both are single best answer questions, and then you have the OSCE. So you need to complete your MRChem, all 3, primary, intermediate, and OSCE, at the end of your ST3, so that you're eligible to go for ST4. And your final FRChem is of 2 parts. The first one is your final single best answer questions, and the second one is your OSCE, which you can start taking from ST5 onwards. So after you've completed all the 5 exams, you'll be awarded the FRChem. But remember, exams are not the only criteria for becoming a consultant. You also need to make sure that you have the other evidences to be registering with either your CSER panel or through your training ARCP, so that you get registered with your GMC on the specialist register. You can subspecialize or dual specialized in addition to emergency medicine. The 3 more common specialties involved are the pre-hospital emergency medicine, which is your FEM, If you do it as a standalone, it is a 1 year, but it can also be combined with your emergency medicine up to 24 months. You can start applying for FEM after your successful ST3 year. You have 2 exams. One is your diploma in immediate care. The other one is a fellowship in immediate care. It is very, very competitive, and you might get, if you get a successful training number, you might get it across the country. So it is ideal that you have an indefinite leave to remain visa when you start applying for your FEM. The next one is your pediatric emergency medicine, where you start applying through your local deanery. Your FEM is your national recruitment, so you apply across the country. It's a national recruitment, whereas your pediatric emergency medicine is in from your deanery. So 1 year, where 6 months you'll be based on an intensive care thing, and the other 6 months you'll be based in the ward and the ED. The next common specialty that most people tend to do is your intensive care medicine, which is your ICM. It may vary from 2.5 to 3 years. You should be finishing your FICUM exams, which is the final FICUM exams, to be eligible to practice as a consultant in intensive care medicine. So if you're applying for emergency medicine and intensive care medicine, and if you've got a successful training number in both, then your total training period would be around 8.5 to 9 years, at the end of which, and provided you've cleared all your exams and competencies, you will be able to practice as an independent EM consultant and intensive care consultant. The timeline, just a rough guide, it might change. So all the interview process and your portfolio stuff, filling in your applications, are available on a platform called Oriel, through which you apply for your training program. It's ORIEL. If you type, you'll be able to get access to it. Your ACCS emergency medicine is a national recruitment, which is headed by the London and Southeast Deanery. Round 1 adverts will be coming mostly in November. So if you're interested in career in emergency medicine, I would suggest that you register yourself with the Oriel platform and just make sure that you get on notifications when the adverts are out. Your DREAM or your ST3 or ST4 is again a national recruitment, which is regulated by your Yorkshire and Humber Deanery. Round 1 will probably in March, and if there are any seats left, then probably both for ACCS and DREAM, you will get it around March or April, and not. If the seats are all filled up in round 1, then you will not have round 2. So ACCS emergency medicine. If you are interested in career in emergency medicine and wanted to apply for ST1, make sure that you spend a few months getting accustomed to the department, as I mentioned earlier, and then you start working through your CREST form, which is your certificate of readiness of entry into specialist training. Please make sure that you have the latest CREST form signed. Go through the CREST form before you submit it to your education supervisor to sign it, so that you know what all competencies to get it signed. There are various blogs and websites describing of how to achieve a successful CREST form. Please go through them. You can start maintaining your own e-portfolio, which the Royal College of Emergency Medicine uses the Kaizen, so you have to pay a subscription fee for it, or you can use other portfolios like Horus if you want to just get your basic competencies signed. Then once you apply for your ACCS emergency medicine, then you will have to sit your MSRA exams, which I hope Aman will be speaking later in the day. There are also websites which explains about the pattern of MSRA and how to be successful in MSRA, and various online courses available. Please go through them. Provided you're successful in your MSRA, then you would be invited for an interview, which during the COVID times has become online, and I think it might change in the upcoming year as face-to-face. Please make sure that you know the exact pattern or the number of stations available for the interview. Make sure that you speak to the people who have recently completed the interview for tips and tricks, and start doing some mock interviews. Once you are successful in your interview, you can choose your specialist area where you wanted to get your training number, and then you'll be given your emergency medicine training number, and you can commence your ACCS emergency medicine training from that area. I would like to quickly run through this person specification which I mentioned earlier. So this is the acute common care ACCS emergency medicine ST1 person specifications. So if you go through it, it says about the essential criteria, MBBS or equivalent qualification, and then it says how it's evaluated through your application form, and then it also tells you that you should be eligible for full registration at GMC at the intended start date. And then it also tells about that you should have the fitness to practice, language skills, and about the health. It also says about how the career progression is about, and then you come to the selection criteria. So the essential criteria is all about, okay, the desirable criteria is if you have any of the desirable criteria, then you have more marks awarded for that, and you have an extra marks awarded for those. If you look at the clinical skills, when coming to desirable criteria, you have an aptitude for practical skills, evidence of up-to-date and demonstrable advanced life support skills. It's about your life support courses like your ALS, ATLS, ETC, and APLS. Make sure that the course that you do is accepted by the respective colleges. Okay. If you're doing an ALS, make sure that it is approved by the Research Council UK and it is accepted by the Royal College of Emergency Medicine. Please don't do like a course outside the country and say that, okay, is it recognized? So please verify that earlier before you enroll yourself in the course. Academic skills, it also mentions about what is your essential criteria and your desirable criteria. It also mentions about your teaching and personal skills, management and leadership skills, and about your IT skills, and so on. This is again an important a box which most people try to ignore. It's commitment to specialty. So what makes you interested in emergency medicine, and what is the commitment that you have got towards your specialty, which will be evaluated in your interview. Please go through this earlier so that you can start working towards your portfolio building, and you'll be able to get a successful training number. The next one, I'm just showing you a sample of a self-assessment score. Once you apply for your training program through Oriel, at the end of it, you will have a self-assessment form, which you need to fill it up. For example, this is your portfolio self-assessment form. I've just given you a sample of your ST3 or ST4 self-assessment form. This is one of the older forms, but you will get an updated one once you apply for the training number. So let's come, for example, for the additional degrees that we looked at earlier in the person specific, the desirable criteria. If you have a master's level degree, you will have a score 3. If you have an additional degree with first class honors, you'll have a extra score 2. No additional degree, you'll have extra score 1. Sorry, 0. And if you have any academic prizes at like a national award, you'll be again having score 3. Local postgraduate award, you'll have score 2, etc. And then for your quality improvement projects, you need to be careful with this. So it says designed and led a completed audit or quality improvement project with closure of loop, then you get score 3. If you have just designed and led but not completed, then it's score 2. If you're involved as a team member, then it's score 1. Or you're involved in an RChem audit, it is score 1. But if you're not done any editor, then you get score 0. Okay. Description wise, again, if you're organized a course, then you score 3, and if you have participated as a faculty member, then it's score 2. But you have planned on a teaching event regularly. For example, you're teaching a medical schools on a regular basis, and you have formulated a plan or schedule for it, then it's score 1. If you have a teaching qualification, like for example, masters in medical education or postgraduate diploma, then accordingly you will have the extra scores. And if you look at your exam status, for example, if you have passed full MRChem or FRChem intermediate, then you'll have score 3. Primary, then you'll have score 2. And as I said, look, if you look at the life support courses again here, so if you are finished ALS, APLS, and trauma life support, then you get score 3. If you have ALS and either of APLS or ATLS, then you'll have score 2 or ETC. But you have only ALS alone, then you'd score 1. Okay, as I mentioned earlier, please make sure that you do the ones which is recognized. ALS should be recognized by the Research Council United Kingdom. If you are doing a trauma courses, then the 2 courses that the RChem looks at are the emergency medicine, European trauma course, and the advanced trauma life support, which is your ATLS. And for PEDS, it is EPALS and APLS. And it also says if you have taken any other additional courses relevant to emergency medicine, which is your airway, ultrasound courses like level 1 ultrasound, impact course, major incident course, or emergency radiology course. Here you have your MSF or 360 feedback depending upon the portfolio you use. And if you have all as an excellent, then you have score 3, and if you have good, it's score 2, and if it's satisfactory, then you have score 1. These are the self-assessment scores. I just wanted to give you an overview of how they rate the score. So the thing is, you need to make sure that you go through your person specifications well in advance and make sure that you start working towards your desirable criteria as much as you can. I'm not asking you to pay 12,000 or 30,000 pounds and do an MSc in medical education, but what I'm trying to say is try achieving as much desirable criteria as you can. For example, you can teach your medical students and then get some feedback from them, which will again improve your score rather than do nothing. So now let's come to the competition ratios of emergency medicine. This is not to scare you, but this is just to give you an overview of things. Just showing, I would just like to put a disclaimer here that showing this doesn't mean that you won't get it or it's impossible. But what I'm trying to say is you need to start working from day one after you get accustomed to the NHS towards your getting your training number. So if you look at it, 2017, the competition ratio is 1.99. Okay, in 2018, the number of applications was 700. As in 2021, it's more or less the same number of posts, 361, but the applications have almost doubled, which is 1424. So for every single applications, there are around 4 people applying in 2021 when compared to 2 people applying in 2017 for ST1 ACCS emergency medicine. Coming to ST3 emergency medicine on the DREAM, the number of posts are limited. Okay, so if you could see in 2021, it was only 37 seats, where your competition ratio is 6.41. So there are around 6.5 per people applying for every single seat of ST3 emergency medicine or your DREAM emergency medicine. For ST4, in 2021, it's 72 posts, and the competition ratio is 1.92 when compared to 1.28 2017. Unfortunately, the competition ratio for 2022 has not been released yet, which will be probably by the starting of August or starting of September. And you can also go through that and see is the competition raising or how is the competition ratios in ST1, ST3, and ST4 emergency medicine. Yes, there is some stiff competition going on. Okay, so please make sure that you are up with it. So to obtain a successful training number, okay, the first thing is NHS orientation. Okay, when you start your first job, first spend few months getting accustomed to the department. Okay, then decide on the specialty you would like to apply for training. Okay, for example, some of your colleagues might have suggested that yes, GP is the best, GP is the shortest, or you won't get neurosurgery, so don't apply for neurosurgery. It doesn't matter. If you are interested in neurosurgery or if you're interested in radiology, but you're working in emergency medicine or acute medicine, speak to your educational supervisors, spend some taste days or taste weeks in the specialty. See if it suits your lifestyle. See if it is if you've got interest in the specialty before applying for the specialties. Okay, please don't go by the word saying that it's short or it's long or it's competitive or not competitive. Everything is achievable provided you work towards the person specifications smartly. So it's both smart work and hard work, which will get you a successful training number. Once you get accustomed to the NHS, you will be given your educational supervisor or a clinical supervisor, who is one of the consultants that you can speak to in case of any queries. Meet with them earlier and develop a personal development plan. So in the first 3 months, my plan is to do a life support course, get most of my CREST forms signed off, get a portfolio, develop it. And the next 2 months, I'm going to sit another life support course or do some extra courses, do some teaching, get involved in audit. So please make sure that you have your personal development plan with your education supervisor and start working towards it. I also mentioned about the CREST form. Kindly go through your CREST form and your person specifications well in advance so that you know what you're working towards. For example, if you work through your CREST form, I would say when you go for today's shift, you can say, okay, today my aim is to see a mental health patient or deal with an end-of-life care patient and work towards it. And then you will ask your consultant, your registrar, to observe you so that they can sign a form for you that you are competent in it. speak to your audit lead or your quality or your quick lead in your local department, and they might help you to get involved in any of those. Kindly make sure that you complete the audit cycle loop. Please don't just do one cycle and say you've done an audit. You need to complete the audit cycle, and you should have presented either in your local department teaching or at your hospital level or your national level as a poster representations to get more marks. As I mentioned earlier, work towards your portfolio, and you can get involved in teaching. It can be your medical students, it can be nursing staff. If you have a consultant available, ask them to observe, or your registrar can observe you, and you can send them a feedback form and they'll be able to fill it. Or you can get the feedback form filled in by the participants or the audience, that you have an evidence that you have been teaching regularly. Portfolio can be, there are lots and lots of portfolio platforms. For emergency medicine, it's Kaizen. You can also use a Horus and etc. Once you're successful in all these and you've completed it, and you're getting ready, you've completed your MSRA and you're gearing towards your your interview, try speaking with the consultant early and start doing mock interviews. I would also suggest that please speak to the people who have done their interviews recently, so that they can give you some tips and tricks of how to ace your interview. The interview format is changing. Okay, it's all practice, practice, and practice. It's about how you are able to convey your information in a precise, concise format in that 5 to 10 minutes. Usually, if it's face-to-face, you will have a portfolio station where they will verify all your assessment, your self-assessment score with your evidences, and then you will have a clinical scenario. Your ethical scenarios will all be covered in your MSRA, and then you will have a station called commitment to specialty, where they ask you why emergency medicine, what's your commitment towards the specialty, and how are you going to maintain your commitment or up your commitment to specialty. Sometimes you might also have a presentation station where they'll give you a random topic, and you will be given around 7 to 8 minutes to prepare on the topic using flip charts. The second station, you'll be presenting your the present that you prepared on the flip charts for around 5 to 6 minutes, and then the last 2-3 minutes they're going to ask you some questions. It keeps changing. I think this year it was a 30-minute online interview where it involved more of portfolio, clinical scenario, and commitment to specialty. But I think they will be going for face-to-face in the future. But fingers crossed to see how it feathers out. I would just like to mention quickly about your less than full-time program. So if you are doing an emergency medicine training program or any training program for that, you have an option to go less than full-time. So if you do full-time, so it is your 6 years when you start from ST1 in emergency medicine. So you can go up to 80% if you are on a Tier 2 visa, because you can't go below that if you're on a Tier 2 visa. But you once obtained your ILR or your British passport, then you can go less than that also. The other option is you're out of program. You can do out of program experience, where, for example, you finish your ST3 and then you fly to Africa or South Africa to get more trauma experience for a year or so, or you can do out of program training, where you go to Australia, you do 2 years, and some of it might be added to your training years. But for that, you need to speak to your training program director with the offer from the concerned hospital, and once they are happy that you will be able to achieve the competencies from that hospital, they will forward that to the GMC, and once GMC approves it, you can go into it. For instance, you are doing pediatric emergency medicine in Australia for around 2 years. I think 12 months might be considered towards your UK training program, and they might subtract that from your training years. The other OOPs are out of program research, where people take 6 months to a year to go out and do some research. If you're interested in that, you can also have an out of program career break, where you can say, no, I just need a break. Then you can go out for 6 months to 1 year and then come back and resume your training. Or you can also have out of program pause. The only caveat to these is you need to apply earlier. You need to speak with the education supervisor and then your training program director well in advance. I would say at least 6 to 8 months in advance, so that they can approve your out of program. That's pretty much it about in a nutshell about emergency medicine. Hope I've given you an overview of the training in emergency medicine in the United Kingdom. For further reading, you can visit archem.ac.co.uk, which is all about emergency medicine in the United Kingdom. And then I also told you about the person specifications, about the recruitment plans for the specialty, and about your CREST forms. Last but not the least, we are working about the IMG experience in the United Kingdom, and I would be grateful if you could all scan this QR code and fill in the survey form. It takes less than 5 minutes. I'll just leave this screen for 2 to 3 seconds, and you can fill this up once the conference is over or the webinar is over. And please forward that to all your colleagues so that they can fill it up, and with these we can improve the experience of IMGs in the NHS. Please do fill it and then forward it to your colleagues. And that's pretty much it. You can email me if you have any queries to my email address, or you can private message me in my Facebook. I've placed the IDs below. Feel free, and then I will try replying it as early as I can. I will take some questions if there's still time.
Yeah, brilliant. Thank you, Dr. Anoop. That was short, sharp, to the point, covered all the relevant points. Fantastic. As always, you come on every year and you do this fantastic presentation that covers a lot of ground. We do get a lot of questions about emergency medicine, and that's not our own area of expertise. So it's great to get these answers in place. There are lots of questions, and I'm going to be honest, lots of them have come our way. So we're not going to have time to go through all of these. Unfortunately, there's so many. So do you mind if we just switch those across to you once we go into the next talk, so you can have a look at some of these, because they're quite individual, I think, to people's individual queries. I don't know if you're okay to do that.
Yeah, I'm more than happy to do that. You can forward that to me, and then I will bat it across your way after you fill up them.
Fantastic. And a lot of people are saying, can I have the email address as well? So do you want to just quickly read that out again so we can get people, if you're happy, people to email you directly?
Yeah, so it is fgh.asd6@gmail.com.
And what was the Facebook Anoop?
It's Anoop.Kishore. You can just search as Anoop Kishore and it will pop up, I think.
Anoop.Kishore. Fantastic. Great. If anybody wants to contact Anoop outside of this conference, then he's been very kind to give his email address there. So please do use that sensibly and wisely, and think about the fact that you might be getting lots of emails coming through. And on Facebook, of course, please send messages there, because that might be a good way to get in touch with Dr. Anoop. A wealth of knowledge, knows way more about emergency medicine than we ever could. So we're truly grateful for you coming on, as always, Anoop. And thanks for kicking off the conference in such a good way and thorough way, I'd say.
Thank you so much, Aman and Pooja. I think, as I said, every time I come to this webinar, my excitement goes up and up because of the variety of audience that you bring around. And kudos to your commitment and for taking your time to organize these conferences. Keep going. Thank you so much. And I think lots and lots of people have benefited from this. And thank you so much.